if somebody was trying to conceive, that like mucus actually helps the sperm like go into the body and meet the egg better. And then like the temperature, increase in temperature, like if the egg does fertilize with sperm, then the increased body temperature helps with sustaining that fertilization, right?
Yeah,
That? Okay.
it's more of a consequence of elevated progesterone. Progesterone we think has this, or we know has this thermogenic effect. So oftentimes that BBT will remain elevated throughout pregnancy, for example. And then, yeah, the cervical mucus,
Oh.
especially like that stretchy middle of the cycle cervical mucus it's a better environment for sperm to thrive, and like you said, provides a smoother medium, like more aerodynamic medium, to frictionless medium for sperm to get to that egg.
Welcome back to the Holistic Hormones Podcast with me, Dr. Ami Patel, pharmacist and hormone consultant. I've transformed my pain, struggle, and journey with managing my PCOS into my passion to support women to gain freedom from their hormone imbalance symptoms. On this podcast, I share practical tips that have worked for me and my clients, as well as conversations from experts in their field.
Today is a guest episode, and we have the honor of having Dr. Ann Hussain with us today. Thank you for being here.
Thanks so much for having me.
Yeah, I'm really looking forward to this conversation. And before we get into it, just a little bit about Dr. Hussain. So Dr. Ann Hussain is a naturopathic doctor and author of the Period Literacy Handbook. Her personal journey with polycystic ovary syndrome, PCOS, and a lack of reproductive health education growing up in Karachi, Pakistan, drives her passion for menstrual health education and operates a hybrid practice offering a mix of virtual care to serve people around Ontario, along with in-person care near Toronto that revolves around period and hormone health, especially PCOS, fertility, PMS, and endometriosis. She is also the founder of the Period Literacy School, an online platform that offers free and low-cost programming for people with periods. He has appeared on Canadian national TV and has collaborated and volunteered with organizations such as Naturopaths Without Borders, VegTO, the Period Purse, and Moontime Connections. Her book, The Period Literacy Handbook, Everything You Need to Know About Menstrual Cycles, Periods, is available to purchase as paperback and ebook through online retailers. And we will talk a little bit about that. But yeah, so much like experience, passion that you have. And so I'm really excited that you're here. So thank you again for taking the time out.
Thank you. It's always interesting to hear your bio in like such a concentrated form.
Yes. Yeah, and I'm sure there's like so much more, of course, that you have done. But the first question I have is, how did you get into the space of what you're doing, and what is the why behind what you do? I know we mentioned a little bit that you yourself have PCOS, which was one of the drivers, but if there's more you could say on that.
Sure. So I always wanted to go into the medical field, and I was actually more on the cardiovascular surgeon track when I entered university and studied biochemistry there. However, my own menstrual journey, as well as some of the courses that we took in biochemistry, like epigenetics and nutrition, those really piqued my interest. And I wanted to have a broader toolkit to support people's health and self-servingly my own, understand a little bit more about my own periods and PCOS. had been put on the pill to, address some of my menstrual concerns, and I didn't tolerate it quite well. I started getting migraines and a variety of different symptoms. So I was trying to figure out what else I could do to support myself, because my family doctor wanted to prescribe me another pill. And, there's a time and place for the pill, but I just didn't want to be on it personally. And then I found a naturopathic doctor at my university, and that was my entry point into naturopathic medicine and exploring that, and then going to school, and here we are. I focus on menstrual health and PCOS, like I said, a little bit self-servingly, but also because there's so many menstrual issues that come up. I saw a lot of pregnancy and hormone-based issues when I was doing my internship as part of our curriculum. And I really love learning about hormones and the body. And that combined with my personal lack of education, as you had mentioned in my bio, growing up in Karachi, it really brought me here.
Oh, amazing. And I know you said it's like a little self-serving, but I feel like, that's what really drives that passion, and for you to be like empathetic with your patients, because like, you really understand what they're going through. And yeah, I can definitely like relate to your story, because it's very similar to my story and how I started as well, and why I do what I do. Similarly, like, just similarly to maybe a lot of people listening, that hey, like, you just have this one option of the pill, and then we're like, okay, like, what are my other options? And unfortunately, even in like the Western medicine, or there's just not enough funding for women's health research and not enough information quite yet. But it's great that you were like, okay, no, I'm gonna get the answers I need to support myself, and now you support others.
Yeah, and I half jokingly say self-servingly, but you're right. It is an entry point to connect with other people, right? When you've been through something, even if it's not exactly the same. And as we know, PCOS can look so differently, and people's hormone-based issues can look so differently. Even within ourselves over time, they can change. So it is a good way to, you're right, like connect really at a deeper level and understand. And currently is the best understanding we have of menstrual and hormonal issues, and that's hopefully going to continue to grow. Some of it's been funding, some of it's just been ignoring hormone-based issues, and not really paying attention to like the diverse populations we have and the breadth of hormone-based concerns we have. So I'm optimistic that in the next like 5 to 10 years we're gonna have some more robust science to go off to support people's health.
Yeah, I'm optimistic too. I feel like just in the last couple of years, I feel like maybe it's because we are doing more of these things, but I think just connecting with others who are doing these things, there's more advocacy for women's health and PCOS too. So yes, I'm hopeful too. So with everything that you're already doing, you decided to write a book, the Period Literacy Handbook. So can you tell us a little bit about why you decide to write a book? Not everyone is like, oh, I'm going to write a book.
I love books.
Okay.
And I love reading books, but I also like writing. I like long form writing, and I know you have my book. It is 402 pages. It's not really a little handbook. It is like a hefty tome.
I was getting that here. Yeah,
I appreciate you. Yeah, it is a long book, and I like long form writing because, as you know, in the online space we lose so much nuance. And I wanted a robust resource for some of the people who see me in practice, because there's only so much we can do in office. And most of health and life happens outside a clinic, right? So when people are living their lives, I wanted them to have a good understanding of their body, something that they can go back to. A lot of my patients' questions is what informed the writing in the book and the topics that I covered. It started off as a very short book when I started writing it it was just going to be anatomy, physiology, and a little bit of like, how do we think about hormone-based concerns? But then it turned into a lot of other things, especially as the sociopolitical and geopolitical landscape has changed so significantly in the 2020s, and we're only in 2024 right now. So yeah, and then I decided that I was going to put a little bit on the specific hormone-based conditions. I wanted to talk a little bit about some of the global issues and the social determinants of health, so those non-medical factors that influence our health and health outcomes, as well as offer some guidance as to how we, in a holistic manner, support not just hormone health but overall health, because ultimately we reach that destination, or that we go along that journey in a similar fashion, and do some myth busting along the way. So I ended up with a pretty long book. So it does start with anatomy, physiology, kind of like a casual textbook, and then moves on into like what our hormones actually do. Contraception I wanted to talk about as well, because there's so many different ways we can think about those, and contraceptives, especially hormonal contraceptives, are used for so many things that are not contraception, right? So we talked about the pill, even the IUDs for like heavy bleeding, where or period pain. So I wanted to touch on those because ultimately the way we make health decisions is highly personal, right? So the way we do that is by having a proper assessment and having discussions and having information at our disposal. And that's what allows us to make those decisions and revisit those decisions so that we can, we're allowed to change our mind and change our decisions based on what's going on and how you respond to certain interventions.
Yeah, and I think it's like having the knowledge to make those decisions, right? Because sometimes even when I was diagnosed with PCOS, I wasn't given options. I was told, take the pill. And I was just like, okay. And sadly, I was finishing pharmacy school, but I didn't know any better. And so it's having the tools and resources to get that knowledge so then you can make those informed decisions.
Yeah, and it's really hard, right? Especially if you don't have a medical background or a scientific background. But even if you do,
exactly.
when you take me out of my expertise, I also get over, even within my expertise sometimes. But when you take me out, it's sort of like starting like a student, right? What are my options? What does this mean? Short term, long term? What if I don't do anything at all? What does that mean? Right? It's very difficult, especially when you also have a lot of noise online and the internet and social media has done such great things for us as people and communities, but also there's just too much out there to sift through that can be quite overwhelming.
Yeah, I agree. And you do address that in the book. So by the way, everyone, she didn't tell me to say these things about the book, but I did get the book and I do like that it's easy to read. And you have chapter highlights in the back, which is also really helpful. But yeah, I think overall the tone of the book, it's easy to read and follow. And a lot of it is kind of taking that clutter out that oh, hey, you may have heard XYZ, but let's just go back to the basics and simplify things. So I do like that about the book.
Thank you so much. I really appreciate it.
Yeah, no, it's a good book. And, I'll definitely link it in the notes. So if anybody wants to check it out, you can definitely get that. And yeah, anything else you wanted to mention before I move on to the other questions?
No, it was a labor of love. I'm very happy with how it turned out. And I'm sure if I wrote it now, it would look like a different book because my knowledge base is a little bit different. The way, right, we're always changing. And that's sort of the thing that I like to emphasize in general, but also in the book, that your health will change, your life will change, your circumstances, your values. Everything changes at the end of the day. All we can do is make the best decision now, and then we can continue to revisit that over time, right? So that's kind of when I was putting this book, and I'm like, oh, I didn't add this, and there's a new research study that came out, and I'm like, well, such is life.
Yeah, and then just relating it back to our periods, right? We have different phases that we go through, and that's changed, but it's aligning with the flow of it because that's just life. There's different things that come up in our life that impact our health and our mindset. Yeah, but yeah, I know you were saying that it's a really long book, but that's why I want to emphasize that it's still an easy to read book. And yeah,
I tried to make it into digestible sections, and the highlights were a recommendation by a friend who read it who doesn't have a medical background. She's like, I need a little summary just so that I can sort of put the pieces together at the end.
Yeah, that was a great idea. And we could talk a lot, probably for hours and hours about all the concepts around periods and things, but I wanted to focus specifically on ovulation because that's a topic I haven't covered yet. So can you tell us a little bit about why ovulation is important? Because when we talk a lot about period health, it's always okay, what is your period? How many days is it? What is the color of the blood? But I feel we don't emphasize ovulation as much.
Yeah, it's true. We focus on the period because it's the most visible aspect of our menstrual cycles, but really, even a period is determined by ovulation. So ovulation, if you're ovulating, it tells us that A, you have the resources and capacity to ovulate, and then B, it's how we make progesterone. So progesterone is our one of the two primary sex hormones that we have, estrogen being the other one. Progesterone, we make pretty much only after ovulation. Without ovulation, we make very, very small quantities. But after ovulation, progesterone goes up. It helps mature the endometrial lining. A process called decidualization starts. And it also decreases uterine contractions. It's a really crucial hormone for pregnancy. When someone does get pregnant, progesterone remains high to keep that lining thick, to help with some of the changes that are happening in the uterus for implantation and to carry a pregnancy. And then also progesterone plays other roles in the body. We don't even know 100% of the roles it plays, but it plays like an opposing but also a synergistic role with estrogen. So impact on breast tissue, on bone health, on mood and mental health, on pretty much anywhere we have progesterone receptors, which are fairly ubiquitous in the body. So estrogen and progesterone, we need them both. And when we ovulate, that's how we're making it.
Yeah, and I think like just to mention this point, but not maybe talk too much about it, I think there's a misconception that like, when people take birth control or the pill, they're quote unquote like regulating their cycle. But the main thing, like you mentioned about ovulation, is like if a woman becomes pregnant, it's because she's ovulating. And as the name birth control says, to prevent a woman from getting pregnant, most birth controls prevent ovulation. And so that is a key point that I just wanted to point out, that like, if you are taking birth control, and if you didn't know, then you're not going through all the phases and you're not ovulating. And so it's really important that's why, like we were saying earlier, it's important to make an informed decision that, hey, do I want to be on birth control, knowing that these are the things, the risks, these are the benefits, what's the best choice for me right now. And if you want to be on it and come off of it, like just discussing with your provider, like, okay, what is the plan for me to come off of it?
Totally. And you're exactly right. A lot of people don't know that that's what's happening when someone is on hormonal contraception, like the birth control pill specifically, that their ovulation is being suppressed. They're getting a constant dose of progestin usually, right? Or whenever they're taking their pills. But yeah, like the way it's working is actually just shutting off that hormone dance. And that's why sometimes in the online space, it's, when you're on the pill, you're not getting a true period, and really it's because we're giving you a constant dose of hormones, and we're not having that cyclical hormonal dance that we call a menstrual cycle.
Yes, exactly. So we talked about the importance of ovulation. So if someone is not on hormonal contraception and having natural cycles, and how would someone know if they are ovulating, and how reliable are ovulation strips?
Good questions. So, so if we have like a regular period and a regular menstrual cycle, we can start to assume a little bit that ovulation is likely happening, right? Because ultimately ovulation is what dictates cycle length. Once you ovulate, you basically are going to have a period around 2 weeks later, unless you're pregnant, or unless you have something called a luteal phase defect, in which case likely our luteal phase, or that second half of the menstrual cycle, is a little bit shorter. But typically for most people, if you're ovulating, then 2 weeks later-ish, plus minus a few days, is when we're gonna expect a period to come. So let's say you have a longer cycle, you're likely ovulating just a little bit later. Now, the primary signs that we're going to be looking for are cervical mucus. So cervical mucus starts to increase before ovulation even starts, because it's a response from the cervix to release that clearish, whitish, off-whitish discharge that's under the purview of estrogen. So estrogen starts to go up before before ovulation, to build up that lining, and that's one of its jobs. So around ovulation time, we might notice that slippery egg whiteys, very stretchy cervical mucus. Everyone makes different quantities. If you're on certain medications, it can even interfere with cervical mucus production, just so it's not as good standalone, but it is a good indicator that we're likely getting close to ovulation, or trying to ovulate, or actually ovulating. the ovulation predictor kits. So those are your LH strips measuring luteinizing hormone. Luteinizing hormone is the hormone that spikes right before you ovulate and then instigates that follicle that has an egg in it to rupture and release the egg. So ovulation strips can be pretty good, especially combined with other signs and symptoms. And that's what I'll say about most ovulation methods, unless we're testing your blood progesterone in that second half of the menstrual cycle after ovulation, or we're using imaging to sort of see if ovulation happened, then the other signs, we use them together because none of them are confirmatory on their own, right? Because there's so many factors that can even influence luteinizing hormone. For example, in PCOS, we know that baseline LH levels can be elevated, and when you do your P strip for the ovulation prediction, it might just be positive for a long period of time. And that doesn't mean you're ovulating on all of those days. It simply means that your baseline levels are elevated. So sometimes you can have a spike, but have the egg not be released, which is uncommon, but it can happen, right? Like the attempt to ovulate oftentimes looks very similar to ovulation. Then there's also basal body temperature charting. So after ovulation, we make progesterone, and progesterone has what we call a thermogenic effect. It can increase your basal body temperature just by a couple of degrees, by a couple of decimal points after the degrees, not just a couple of degrees.
Good point.
Yeah, we do need like a thermometer that has like a couple of decimal points, because it's not going to go from like 35 to 37. It's going to be in points. So basal body temperature can go up after ovulation, but again, like if you have a thyroid disorder or if you're on certain medications, that might not be the case. Or if you do shift work and your basal body temperature is all over the place. So that, again, like those signs we want to take with a grain of salt and all together. But yeah, those are typically the ways we're looking. And then to confirm, we're usually using blood work. Like that's the most accessible way to test your progesterone after ovulation.
Thank you for being a dedicated listener and viewer. I'd love your support in reaching more listeners so more women can become empowered about their hormone health, PCOS, and fertility. You can do that by leaving a review or engaging in this video. As a way to say thank you, I'd love to give you a free 45-minute one-to-one consultation. During the consultation, we'll go over your medication, supplements, labs, lifestyle, and address your current challenges to help you get direction and break out of your plateau to support your health goals. All you have to do is on Spotify, make sure you're following the show, click the 3 dots to rate the show and give it 5 stars. On Apple, make sure you are following, scroll down and click ratings and reviews and write a review. Or on YouTube, make sure you're subscribed, have your notifications on, you've liked this video, and left a comment with your thoughts. You only have to do this on one of the platforms that you're currently listening or watching on. Then take a screenshot and email me hello@dramiPharmacist.com. That's HELLO@DRAMIPHARMACIST.com. Now back to the show. Thank you.
And so touching on like the cervical mucus, so I guess like to help people remember, like the purpose of that is like if somebody was trying to conceive, that like mucus actually helps the sperm like go into the body and meet the egg better. And then like the increase in temperature, like if the egg does fertilize with sperm, then the increased body temperature helps with sustaining that fertilization, right?
Yeah, it's more of a consequence of elevated progesterone. Progesterone has this thermogenic effect. So oftentimes that BBT will remain elevated throughout pregnancy, for example. And then the cervical mucus, especially like that stretchy middle of the cycle cervical mucus, it's a better environment for sperm to thrive, and like you said, provides a smoother medium, like more aerodynamic medium, to a frictionless medium for sperm to get to that egg.
Yes, and then I guess we should have mentioned, but what is the window of ovulation? Like, we have general period of like when we're on our period, that could be 4 to 7 days. So what's the general window of ovulation, which is when we are most fertile? But yeah.
Yeah, so sperm can live in the body for 3 to 5 days. So that's kind of how we calculate the fertile window. And then it's also going to be dependent on cycle length. So if someone has a cycle length, let's say of 30 days fairly regularly, again, plus minus 1 day, then you're likely ovulating on cycle day 16, which is 2 weeks prior to your cycle length, your full cycle length. And then we subtract 5 days from that. So that's day 11. So around cycle day 10 to 17-ish is probably what we're looking at for your fertile window. So we need a few months worth of data in order to really understand those patterns a little bit better. If someone's cycles are all over the place, it becomes a lot more difficult to pinpoint if if ovulation is happening, and B, when ovulation is happening.
Yeah, and then like on that note, with like the ovulation strips and looking for these things, it's still even more narrow window, just like if you're looking at your own factors, right? Like what is it, like 6 to up to 23 hours, is it?
Yeah, the LH strips typically are going to be at their highest reading at 12 hours before the egg actually is released, around there. And then the egg only lasts for like a day.
Yeah.
So if pregnancy is something that someone is working toward, then we actually want sperm around in the system before you even ovulate. And sperm, depending on the health of the sperm and the quality of the sperm and the environment in someone's body, can, as I mentioned before, live for 3 to 5 days.
Yeah, and that's why, like, as you already said, it's important to take multiple factors into consideration, because if you're just tracking the body basal temperature, that happens after you ovulate. So then that's like, keeping in mind that, okay, you already ovulated. So that's why it's important to have patterns, as you mentioned, track for a couple months, and take multiple things into consideration, not just like look for one thing.
For sure. And always talk to your healthcare provider if you have questions, right? I feel like we oftentimes go to our healthcare providers when something is wrong, but we can go in with questions that we have, right? Depending on your practitioner. In Canada, at least, we have a shortage of family doctors, and appointment times are really short in our public healthcare system right now because the burden is so high. But you can, summarize your menstrual cycle in a couple of sentences and just pose the question, does this sound normal, or does this sound like a healthy cycle? Should I be looking out for something else? So I think those are good conversations to have with our healthcare providers, but we oftentimes forget that we can ask those questions.
Yeah, I agree. I think that even in America, we have those short appointment times, and I feel like maybe sometimes providers don't go in depth with answering questions, but I think at the end of the day, you understand your body the best and you have to advocate for yourself. So even if that means you need to find another provider, know that it's okay to do that, so that you're getting the care and help that you need.
Yeah, and oftentimes you need a few different practitioners on your team, right? And each one will serve a slightly different purpose. My job, a lot of the time, a lot of the education piece is coming from me because family doctors don't have the time. And sometimes because they're generalists, they have forgotten some things too, right? Every family doctor will have a solid understanding of X, Y, Z, especially acute concerns, but some of the other things, then they're either referring to a specialist, or, for example, I oftentimes am filling in the education gap.
Exactly. Yeah. I like that point that, it's a team of healthcare providers that are there to help us.
Yeah.
So what if how would somebody know if they're having an ovulatory period? They think, hey, I'm having a period, so I must be ovulating. But maybe they're not seeing the signs, or they are seeing some signs, or they think they're seeing the signs. But yeah, what if they're not ovulating? How would they know?
Yeah. So anovulatory cycles, so cycles where we're not ovulating, are very common early on. So after menarche, after the first period ever, when your body's still learning to mount a menstrual cycle, as well as in perimenopause. So when we're reaching our final period ever, we don't have that many eggs or follicles left. So the body's like, hey, let's try to do this, but sometimes it's not happening, and more frequently than not, as we get closer to that final period ever. And ovulatory cycles can look like a lot of things. They can look like missing periods. So your period used to be there and then now it's just disappeared, or it takes months on end to come, or it comes irregularly. That could be the manifestation of an anovulatory cycle. An anovulatory cycle can also look like sporadic bleeding, whether that be heavy or light. And I know this can be really confusing, but sometimes it's just the dip in hormones that is destabilizing the lining, and we can start to see a little bit of blood flow, whether that's spotting or like a really prolonged or heavy bleed. So for example, in PCOS, oftentimes we'll see no period for a while and then like a super long or heavy bleed, right? Where people are like, I've been bleeding for 3 weeks on and off. What is going on? That's likely us having an anovulatory bleed after having exposure to estrogen that built up our lining for a while, right? So there's those are the ways. We can also do imaging. We might see polycystic ovaries and an anovulatory cycle, but sometimes the ovaries do look normal depending on what's going on. And then I was going to mention something that slipped my mind, but I did want to touch on the IUD. With a hormonal IUD, sometimes you can, even though in most cases you're going to continue to ovulate, but your bleeding patterns might change because of the IUD and how it works. It thins out the the uterine lining. But with the IUD, sometimes, and especially in that first year, people can stop ovulating, but we can't really pinpoint for the most part. And sometimes, that was the point I was going to make, sometimes if you have bleeds but no PMS, when PMS is like your standard, that can actually indicate an anovulatory bleed, because PMS typically happens because of fluctuating hormones.
Hey, that's a very good point. Yeah. And on that note, I know that like sometimes people get told that, oh, like you don't ovulate when you're breastfeeding, or like people with PCOS, if they get like a diagnosis of infertility or they have long irregular cycles, they think they're not ovulating. But I've heard many stories of people getting pregnant during these times. So can you touch on that a little bit?
I'm just gonna take a second to go. Excuse me.
You're all good.
I just wanted to make it through your question so you didn't have to repeat it. Excuse me. Okay, so sorry, I'm just gonna go back to your question. So your question is like breastfeeding, and what was the other part?
Like with people, some women having PCOS, and if they have like really long irregular cycles, they get told that they can't get pregnant and they think they're not ovulating. But during both of these times, like, you know, a lot of people end up getting pregnant because they think they're not ovulating. So yeah, that's such a horrible myth and misunderstanding with the big consequence there. But yeah, if you could just talk about that a little bit.
Yeah, so let's talk about breastfeeding first. So changing hormones while you're lactating can interfere with ovulation, and it can interfere with bleeding. However, you can still ovulate while you're breastfeeding, and actually it's not uncommon for people to get pregnant while breastfeeding because they think that, oh, I haven't had a bleed yet, so I must not be ovulating. And while that might have been true like for the earlier part of that time, you can still ovulate at any given point in time, and it only takes one egg to conceive at the end of the day or to be fertilized. So it can definitely happen, and it takes people by surprise because they haven't seen a bleed yet, but the first time they ovulated, they got pregnant. And then when it comes to someone with irregular cycles or PCOS, again, like you can still irregularly ovulate and hence have an egg that can be fertilized. And that's where that misconception comes from, that if you have irregular cycles that you're not going to get pregnant. It's just that the likelihood of getting pregnant is a little bit slimmer, especially if you're trying to time things, because we don't know when your fertile window is, but you can still spontaneously ovulate.
Yeah, and I like how you said it earlier about like the period happens after we ovulate, and it's like, I guess, like we are taught this understanding that like day one when we get our period is the start of our cycle, but really, as you mentioned earlier, it's like we ovulate and then 2 weeks later we get the bleed. And so that's why like with breastfeeding, you know, we're we're waiting for that bleed, but really it's like we ovulated and then, for some people they could have fertilized. But yeah, that's a good point that you made earlier. And so you also did mention that, progesterone is really important for us to have regular cycles, but then how do we break that cycle of, hey, I'm having irregular periods, or I'm not making progesterone regularly, and how can we break that cycle so that we can increase our progesterone naturally to boost our ovulation?
Yeah, so typically we want to flip that on its head, where we want to get you to ovulate so you can make adequate progesterone, which means that we need to figure out why you're not ovulating, right? Like, is it because you have PCOS and we need to work on that hormonal milieu or the insulin resistance that causes those hormonal changes? Is it that we're looking at hypothalamic amenorrhea, where our energy requirements or brain ovary connection has been disrupted because of either we're going through psychological stress or physical or physiological stress, like under eating, or just not meeting our caloric needs? Is it because we have high prolactin, like we see in not just in lactation, but also with certain kinds of tumors? Like, what is it? Is it a thyroid disorder that we need to work on? And the thyroid needs the thing that needs to be supported, so we have regular ovulation. So that's the primary way we're going to think about how we boost our progesterone production, is how can we get you to ovulate regularly? Now, obviously, once you are ovulating, there can be reasons why you're not making adequate progesterone. And again, we need to figure out why first before we go in and intervene. So we were talking a little bit earlier about how when you ovulate, you get a period 2 weeks later. But if you're ovulating and your period is coming, let's say, a little bit sooner, and that luteal phase is shorter, then that could be for a few reasons. We don't fully understand why is going to be the theme of a lot of hormone-based conditions, right? We don't fully know why yet. Let's use the word yet. Yeah. Hopefully in the next 5 to 10 years, we'll know a lot more. But that can also happen where we're either not responding to the progesterone that we're making, or we're making low levels of progesterone. And sometimes it could even be related to aging or reaching menopause early, like we see in something called primary ovarian insufficiency. So there's lots of different reasons, but the assessment, which is going to be conversing with your healthcare provider, doing some testing together, right? That's how we do that. And the primary thing that people can do on their own is really track their cycles and track anything that they're noticing, because we need that longer term data to see what is happening exactly, and when the disturbances came, and what other symptoms might be accompanying whatever it is you're experiencing.
Yeah, and on that note about tracking, what are your thoughts on tracking apps or doing it by paper? Yeah, I know there's oh, sorry, I was just gonna say I know people are oh my God, I don't want to give my period data to whoever, and yeah, all of that's happening now.
Yeah, and I think that's definitely a bigger problem in the States currently, just with the political climate there as well. So I grew up with didn't really grow up with a cell phone or much apps. So paper and pen is how I did it. And to this day, I actually just use my calendar app on my phone to do that, because it's easy. Right? It's easy for me. I look at my calendar all the time to see what's going on. So it's easy for me to just put it in there and not forget about it. I know it's very easy to just open up an app and put it into it, but for me, that's a barrier. So you have to understand who you are and what's best for you. The phone apps, the health apps, oftentimes are good places. And if someone is looking for apps that don't collect data, I'm fairly certain Clue does not. There's also one called Menstruation Nation that is made by a Canadian nonprofit organization called the Period Purse. They make an app called Menstruation Nation, and they do not store data. So that's a great one, and it's a free app to use. And then ultimately, some of it is going to be personal preference as well, right? What interface do you like, free versus paid? And are you gearing more toward fertility? I'm a big fan of just like a simple app with like a nice notes section where you can make some extra notes as well, whether it's like digestive change or you get headaches or acne or breast tenderness, whatever it is. So you have like some area to plop in some information that is likely not going to stay in here long term.
Yeah, yeah, no, that's a good point. I like that. Yeah, thank you. Very good tips there. One more question, kind of going back to the progesterone question. So, what are your thoughts on seed cycling and cycle syncing? So, for people that are listening, just like seed cycling is basically supporting that estrogen progesterone ratio by having different seeds during different cycle or phases in the cycle, like flax and pumpkin seeds during the first half of the cycle, and sunflower and sesame seeds during the second half. So, yeah, thoughts on both of those things.
Yeah, so seed cycling doesn't necessarily have any scientific data behind it. Am I a big fan of people having seeds in their diet? The answer is yes. So if someone wants to do it because it helps them feel connected to their menstrual cycle in the different phases, I'm all for it. Does it have a huge impact on the menstrual cycle on its own? I would say likely not, right? But is it having an improved impact on your overall health? Because the recommendation is to eat 20 to 30 grams of nuts and seeds on most days. Probably yes, especially if you weren't having any nuts or seeds in the past. So I think like nuts and seeds are great to add into anyone's day and diet for hormone health and for their overall health and cardiovascular health, for example. And if seed cycling works for you in your schedule, great. But I think you could just do a mix of seeds that you like. Especially, I'm a big fan of the flax seeds, especially because of those isoflavones and phytoestrogens in them. Have been shown to be beneficial for PMS, especially. But yeah, like add more seeds and nuts in general. Whatever ones that you like is sort of the theme currently. We always can change our mind, right? Like based on the science oftentimes, and that is what science does. It's just a tool to understand and then deepen our understanding over time, and there's nothing wrong with changing our tune when we know better. When it comes to cycle syncing, so again, like I do think cycle syncing is great in many ways, especially from like a bringing awareness to how you're feeling in certain phases of your menstrual cycle and helping you connect with that and understanding that not every phase feels the same. However, ultimately, do we need to do a whole ton that's different from phase to phase? The answer is no. Most of us, I think, would be better supported if we like have solid meals in our day that are sustaining our energy. I think part of the problem is in the luteal phase when people tend to be a little bit more symptomatic in the late luteal phase and that lead up to a period where there can be a little bit of fatigue, a little bit of water retention, a little bit of irritability, and maybe insomnia and other symptoms. And those can be quite disruptive to life. If they're disruptive to life, then we categorize that as PMS, right? Or if there's volatile emotional changes, then that we might even be looking at PMDD or premenstrual dysphoric disorder, for which we probably need a very dedicated strategy. But for most of us who are feeling fluctuations in how we feel, it's probably our lifestyle that's playing a role there, like stress, sleep, nutrition, water intake, caffeine intake, alcohol intake, right? And working on those obviously is a great thing because I think you'll feel much better. But the suggestion sometimes is to like slow down your activity and things like that. But it's likely that we need to support your nutrition a little bit better so that you can do the activity, because the activity will help you with that phase of the menstrual cycle, right? Like luteal phase, if we look at what supports it, or PMS, what helps, exercise is one of the strategies we use. And we want to be encouraging patients and people to exercise more because most of us don't get enough exercise on an average, right? Like, so cycle sync, if you feel good on it, great. However, the foundations are the most important thing there first, because most of the time I see patients who are like, yeah, I have a banana and coffee in the morning, and then I'm just like crashing by lunchtime, even though I've had lunch. But the thing is that let's say this is you at bedtime or after dinner, let's say this is the energy you need, and this is where you are after dinner, because people mostly have, Excel time. You're sleeping and then you're waking up and running around. And then let's say you have a coffee and a banana. You're not coming up here. You're just like staying down here. And then you're doing more, more, more. And then you eat lunch. And then again, you're not coming up here. So I think we just need to support ourselves better. And then also understand that your fluid dynamics are going to change, right? Like you might retain a little bit more water. That's not like inherently problematic, but you can support that a little bit by having more vegetables that are potassium rich. Watch your salt intake, which can worsen water retention. Watch your caffeine and alcohol intake, which can worsen breast tenderness and a little bit of that water retention. And then our metabolism can go up anywhere from 20 to 200 calories in that time frame. And by looking at you, I couldn't tell you who is 20 calories more and who is 100 calories more, right? But you might just need a little bit extra food, especially when you do the most in your day, so that you feel a little bit better, and also don't then fall into the, oh, it's nighttime now, my body's sending me all the signals to eat all the things, whatever I can get my hands on.
Yes, to everything you said. Yeah, it was yes, a lot of valuable things you said there. I think, I love the point that you made, that you're not gonna, like, seed cycling isn't gonna outweigh your lifestyle. And then, with seed cycling and cycle syncing, like, if it's adding more stress, then it's not really helping you, right? Because there is, a lot of things that go into some of the things, like depending on how particular you want to be, but that's not the point of either of these things. It's to help, in addition to having the foundational lifestyle changes that you already mentioned. And then, there is like a lack of research in those things, but I mean, like, nobody really, like, we hardly have research around medications for like women's health. No one is really gonna be doing research on seeds probably, but we know that, as you already mentioned, they are nutritious, and so there's already like a lot of health benefits that come from that support our hormone health. Yeah, great points that you made. I think that is everything I wanted to ask you. I'm still just like thinking about everything you said, and if there was anything else. There's something you said at the end that I wanted to touch on, which I can't remember right now, but it'll maybe come to me hopefully before we end the conversation. But was there anything else you wanted to say? Because those were all the questions I had before we just have me asking you how people can connect with you. But before that, is there anything else you want to say?
No, I kind of just want to reiterate that, track your symptoms, track your menstrual cycles. We forget things. I forget things all the time, right? Like sometimes even seeming like important things, right? Like if I place it somewhere and I'm like, this is a great spot for it, I likely will forget it at some point if you give me enough time. So I write it down, because it's the best way to have a good record of what's been going on, right? Like sometimes even patients will come in and they're like, oh, my period pain was like an 8 out of 10. And before it was 10 out of 10, right? But they're like, this is the worst period I've ever had. I'm like, well, let's go back to some of the things that you've shared with me, right? Like, so the record is really helpful for you to look back on, and just assume that you're going to forget. Because we all have competing interests and, lots going on in our lives, right? Like that's the reason why. So track your menstrual cycle, especially if you're noticing things that are different than your usual thing, right? Like if you're noticing a new symptom or a new pattern, if it's a one-off, that's what I wanted to mention. If it's a one-off, it's likely something we can just move past and keep an eye on for the future. If it's a one-off, if it becomes a trend, then that probably needs an assessment or investigation, right? Like, and that's where the power of tracking, or the utility of your tracking data, will be. And then going back to our last point, or your last question about the cyclical habits or cyclical changes, the foundations are most important, and then you can add in nuance after if you'd like to, right? Like, again, like I love so many aspects of and the theories behind cycle syncing, because they do really connect us to how we're feeling and what's going on in our bodies. However, in order for us to really interpret those signals and the things that we're noticing better, I think the foundation still needs to be in place, because you might notice something very different when you're like meeting your caloric needs and not like consuming too much alcohol or caffeine. You might just feel better automatically without like trying to change your whole life around it.
Yeah, and it's like ultimately making those little changes that will have the biggest impact, and like cycle syncing in general, or just in general, like just listening to your body. And I think some people like maybe like, okay, if I'm cycle syncing, I'm paying attention to my body more. But at the end of the day, it's listening to your body and the needs that it has. And oh, I remember that point. So I like how you mentioned that, sometimes we need more food during like certain times. And so I think that's really important to point out, because I know like a lot with like diet culture, people like trying to lose weight, we focus on eating a certain amount of calories every day, like indefinitely. But it goes back to the point that, we as women, we have fluctuating hormones. And so at certain times we may need more. And so respecting our body and our needs for that, which ultimately will prevent some of those like cravings that we have at night, which you mentioned. But yeah.
Yeah, exactly.
Yes. So great conversation. Thank you. I loved how you explained everything. And that's just a preview, everyone, for how she explains things in the book. So yes, check that out. I will link that in the notes. But how else can people connect with you online?
You can visit my website, which is annhussain.com. And then I am most active, so like for social media on Instagram. So that would be at dr.dr.annhussain.
And yeah, she also has the free resources, the Period Literacy School. And I noticed you have some free resources around nutrition to support PMS and endometriosis as well. So yes, all of that will be linked. But yeah, thank you again for your time. And for everyone listening, as always, be kind to yourself, be patient, and focus on progress, not perfection.
Thank you so much for having me.